The Netcare group has released a statement saying that strict measures have been implemented to curb the spread of COVID-19 at the St. Augustine's Hospital in Durban. They've said 47 healthcare workers at this hospital have tested positive for the virus after 2 patients were admitted in March for other reasons. They had no history of international travel and did not have symptoms of the virus upon arrival at the hospital. Our reporter Karinda Jagmohan starts us off at this segment. All right, Karinda, tell us about the healthcare workers that have tested positive. How many, and what is the condition and the reasons that led to them testing positive?
Well, good day to you. The Netcare group has released now their second statement since we heard about the positive testing here at this hospital. Dr. Richard Freeland, the group's CEO, has confirmed that 47 of their healthcare workers have tested positive for this virus. This is different from the number given to us by the health minister yesterday. He said 48 healthcare workers were tested positive. But just to give you an in-depth briefing, we understand that there are 1,982 staff members here working at this St. Augustine's Hospital in Durban, many of them being doctors and other staff, contractors, really the people who belong to this particular hospital. More than half of them have been swabbed, more than half of them have been tested. We understand that 504 tests came back negative, and the hospital is now waiting for the results of 318 tests. Now, with regards to the doctors and medical staff who tested positive, we understand that 47 of them tested positive, 33 of them are in self-isolation at their own homes, 14 of them are being accommodated by the Netcare group to safely self-quarantine, and then going forward now, we understand that one person among the group who initially had tested positive has now tested negative, and we understand more tests will be done until that patient can be discharged. The Netcare group has clarified that since the start of the COVID-19 outbreak here in South Africa, 4 patients died at this hospital because of COVID-19 related reasons. Now, since the beginning of March, 2 patients, we understand, were admitted here to this hospital for other reasons. They didn't have any history of international travel, and they did not show any symptoms of the virus upon arrival. We understand that this is when the infection began. Now, in his statement, the Netcare CEO says that this virus is highly infectious, but unfortunately, in many cases, people do not show symptoms of the virus despite being infected, and only in later days or a week do they start showing symptoms, and of course, themselves can get treated, but the interim can infect others. And he says that realistically or possibly the ideal scenario would be that people are tested several times or screened several times before entry in a place like a hospital or other places that would be congested. However, this is not the reality in South Africa, and therefore we are seeing these high rates of infection carrying around. However, there are measures that the hospital has put in place to prevent the transmission of the disease.
Now, Karinda, what are the measures that the Netcare group have put in place as a way of curbing the spread of COVID-19?
Well, we understand that since the outbreak began at this particular hospital on the 2nd of April, immediately the trauma unit was shut down, and other places where the infection could have been was shut down as well. We know that local government is in talks with the management of the hospital to understand how further or what other parts of the hospital should be closed. But since then, disinfection of the hospital has begun. This includes the use of ultraviolet light, and that disinfection process is continuing as we speak. The hospital itself has cancelled all planned surgeries and admissions, and they are accepting no new patients, of course, until they're given the all clear by the Department of Health. Now, going forward, they are contacting patients who've been at the hospital or visitors at the hospital since the 1st of March to ensure that they can screen those patients and ensure the safety in terms of mitigating the transmission transmission of the virus. They also have a hotline, the Netcare 24-hour hotline, and that number is 0800 111 266. This is a number that patients can call should they have been to the hospital since March and they feel that they need to be screened in order, of course, to curb the transmission of COVID-19. The hospital has also emphasized that there is no shortage of PPE at their hospitals here at St. Augustine's. There were complaints allegedly by healthcare workers via unions of the shortage of PPE and fears over, of course, being at the front line of the battle. The hospital says that they've retrained over 1,000 workers on the correct use of PPE, so going forward that they are protected as they work to combat the spread of COVID-19.
So earlier on in Wentworth, workers there were concerned about the shortages. Is that a similar case at this hospital?
We have not seen any instance of workers downing tools at the Wentworth Hospital in the morning. There was a brief period when workers had shown that they were frustrated over the rationing of PPE. Wentworth Hospital, a private hospital, and there, of course, the Department of Health needs to intervene. We understand those workers have returned to work, and NEHAU, among other unions, are assisting healthcare workers with regards to the shortage of PPE. Here, we did hear of some nurses complain about a lack of test kits. However, the statement from Netcare says that they have supplied PPE to all their healthcare workers and saying that they've retrained workers as well on the correct use of PPE. This is because this hospital itself is also seeing a number of patients that have tested positive for COVID-19. They say that there are 15 pre-existing community-acquired COVID-19 patients that are in its dedicated isolation units at present and are being treated. One of those 15 has since tested negative for the virus and will be discharged shortly. So they are treating patients, and therefore they're saying that they are indeed supplying PPE to their workers. Globally, however, we know that there is a critical shortage of this very important equipment, and of course people have been asked, or the private sector rather, have been asked and called upon to donate what they can to ensure that healthcare workers, which are the primary soldiers in this battle, are protected, to ensure that as a country we can flatten the curve.